And coming up next, we are honoring Black History Month. Today we are at Diamond Health, which was created by a very celebrated Dallas doctor. Also talking today, though, about some of the health disparities that still very much exist for African Americans. So listen, we're having this conversation about Black History Month, and I just had to take a little bit of a look back on your career as a doctor. Was this something you always wanted to do? How did you get into the profession?
When I was 5 years old, and I remember this very vividly, I would watch surgery on the Learning Channel. And my mom thought I was a complete weirdo.
Well.
But I was fascinated with anatomy and physiology, and that's kind of how I got into science and medicine, and it kind of started that vision and that dream to be a surgeon. I wanted to be a surgeon.
That really is incredible at such a young age to have that passion and to have a dream and to accomplish it and to be doing what you're doing. Talk about what you've created, because what you've created at Diamond Health is actually pretty huge.
Yeah, so, I went into medical school to be a surgeon and went to Cedars-Sinai in Los Angeles to do general surgery, and just wasn't a good fit for me. I love being in the operating room, but I'm a people person. So switched over to family medicine, came back to Dallas, where I'm from, finished my residency here at Methodist, and started Diamond Health in 2013.
We were looking at this UCLA study, finds that the proportion of Black physicians in the U.S. has increased by only 4 percentage points over the last 120 years. So we look at that, in Dallas, Black population, according to the Census Bureau, is about 13%. It seems like there's just not enough Black physicians. What do you make of that study?
And it's even worse for African American males, so for Black male doctors.
Yeah.
Black female physicians, they've actually increased over the last 60 years, but Black male physicians are the exact same. We have not increased the amount of Black physicians in this country at all. And that's sad. It's important for Black physicians to understand what's going on and to really try and inspire and be role models for our youth to encourage them to go into medicine.
Right, there has to be that recruitment, right? And there has to be that vision. Somebody has to see somebody else and think, he's doing it, or she can do it, I can do it too. Can you explain why, for the patient, this is important too?
Well, the studies have shown that people want to see physicians that look like them, that share the same ethnic group or the same culture. They feel more comfortable. They feel like they can trust that person more, and that's across all races and ethnicities. It starts with racial bias, and unfortunately it's so ingrained in our society from the way Black males are depicted in the media. Black males have less access to school resources. They have less access to advanced placement classes, STEM classes, and that has to change. Yeah, it's a huge sacrifice from a time perspective and financially. So I want to encourage Black youth to understand and see that they can do anything they put their minds to. And I tell my son, he's 5 years old, that every night, you can do anything you put your mind to.
If somebody's watching this right now and thinking, gosh, you know what? I think I want to do this too. What would be the first step for a young one? Somebody that's, 10, 15 years old, what would your encouragement be to them?
Yeah, I would absolutely say find a mentor, someone in the space, in the medical space that you'd like to shadow, and that's the first step. Get involved with your community physician. We'll always have our doors open to allow people to kind of get a taste of what we do.
Listen, you were on that big TV show, Chasing the Cure. What was that like to be highlighted like that and celebrated like that?
That was an absolute dream come true.
Yeah.
I love medical journalism. I love to teach. So when you get to combine the medical background and teaching the general population, it was an amazing experience.
Dr. James, thank you so much.
Thank you.
So here's what we will do. We will link everything to Diamond Health and that study we referenced earlier on our website, CW33.com.